What's going on, crew? Dr. Andrew Fix back for another episode here on The Code. And if you're watching this one on video, the light's a little bit dim. The sun is trying to rise here in the Denver, Colorado area. It's very cloudy outside. Not one of those, many days of sunshine that we get so far today. So I appreciate you bearing with us. The noise, the sound on this one might be a little bit different, but we appreciate you listening to this podcast. However you're tuning in, we really appreciate your time, and thanks for being here. And I want to record this episode, on a topic that came up the other night. We were holding a workshop in one of our clinic locations, and this workshop was kind of on the topic of how do you heal and renew tissue, how do you restore function, and then how do you optimize performance on the back end. And we were talking about shockwave technology, how that works, how that's utilized to try and heal and restore tissue, recruiting stem cells and things to the area to try to heal an injured area. And then we were talking about how physical therapy fits into this, like how the reset, restore, reload framework that we prioritize here at Physio Room. How do we take the person, assess them, figure out what we believe is the root cause of what's going on that's leading to their symptoms that they're dealing with, whether that's pain or numbness, etc. How do we restore their function, whether that's strength, that's mobility, that's optimizing and improving their mechanics. And then from a training perspective, how do we optimize their performance and whatever they're training for? They could be training for life, they could be training for running, they could be a cyclist, they could be a CrossFit athlete, like training to pick up their grandkids. It doesn't matter. How do we optimize and structure their training regimen to help them achieve the goals that they want to achieve? So that's what this workshop was on. And one of the questions came up from one of the participants who's dealing with like some lateral elbow pain, that tennis elbow kind of area. And she said, man, all of this is great information, but when you start dealing with something, how do you know where to start? And we kind of, the few of us that were giving this talk or this presentation, we kind of paused and we said, this is a great question. How do you know where to start when you have all these options? There's so much information out there. You could watch YouTube videos. You could go on the internet, find things. You could go to your physical therapist, physician's office, chiropractic office. I mean, you name it, the list is, I don't know if it's endless, but it's extremely long, right? There's a lot of options of things you could do. But what should you do? And what we decided to answer the question with and tell this woman was, if this is a brand new thing that you're dealing with, this is not something that's been going on for many months, this is a new irritation, you're exercising, you start developing this elbow pain, probably one of the first things that you should do is, try to take a stab at it yourself. And, what I mean by that is not necessarily go down every rabbit hole on the internet, but you started having this elbow pain, you should take an assessment of like, okay, when does it bother me? What was I doing when it started hurting? And what can I try to do to help it feel better? You could massage into the muscles on your forearm. You could do some light stretches or mobility work for your wrist, for your elbow. You could take a lacrosse ball and massage into the back of the upper arm, the tricep. And you could see and assess, hey, how are these things working? How are these tissue mobilizations and these gentle stretches and potentially some strengthening exercises, right? You can strengthen the muscles of the forearm and the elbow with dumbbells, with bands. And if this is a relatively new acute irritation, that's a perfectly fine way to, try and figure out what's going on your own. Now, you must keep in mind, sometimes we have symptoms in an area where that area is not the actual root cause of the problem. Sometimes we have lateral elbow pain and it's coming from our neck, or we have pain in our elbow, but really the root cause of that is our shoulder is lacking stability. Then when we're doing exercises or movements, we're putting more stress on the muscles of our wrist, our forearm, our elbow, because our shoulder is bleeding that stability. It's not doing its job as efficiently as it should, and more stress is being put somewhere else. This is a very common scenario that happens. So keeping that in mind, it's quite possible that you could do tissue work, do stretches, do exercises to strengthen around that elbow, wrist, and forearm. And that may improve your symptoms for a while, but it may not address the root cause. So that's definitely a possibility. But you should take a stab at this yourself first, because nobody knows your body better than you do. Second, say you are, like this particular woman, training at a facility, you're doing classes, and this symptom started to come on. It would be very appropriate to ask some of the people, the coaches, the trainers at that facility, hey, I started dealing with this elbow pain a week ago. Do you have any thoughts on this? Can you help me try and figure out what's going on? Because if they're the person that you're seeing day in and day out, or week in and week out, they're coaching you on movement, they're coaching you on exercise, they may be very familiar with these types of symptoms that you're dealing with. You should ask them. You should ask the people who are in the profession or in the arena doing the things every single day. And I guess what I mean by that is, if you're starting to deal with a musculoskeletal issue and you're one of the folks that has one of these primary care providers, that when you go to see them, you get 7 minutes in their office, you sit in the waiting room for God knows how long, you leave there with a recommendation of, hey, go ice this and take ibuprofen, or here's this prescription, take this for 2 weeks and see how it feels. That doesn't do anything. That does not fix your musculoskeletal problem that you're dealing with. And we're in the business of trying to help people fix issues, not mask symptoms. So my recommendation would be, go see somebody who really knows what you're dealing with. And every primary care provider that I've ever spoken with would agree that they're not the person that's the expert in musculoskeletal pain. Now, that doesn't mean they're completely uneducated about it, but that is not their expertise. That is not the thing that they are the best at, that they're world-class at. But this is the thing that performance-oriented physical therapists, performance-focused, rehab-based chiropractors, like really good coaches and trainers, this is what we're good at. This is literally what we do every single day. So those are the type of people that you should ask when you're dealing with these types of issues. Okay, so say now you've been dealing with these symptoms for a few weeks, and it's turned from this little annoying thing that you were hoping would go away, because sometimes we have aches and pains that go away within a few days, and they don't continue to bother us. You take a stab at this on your own. Maybe it feels like it's helping, but it's not really going away. Now it's 2 weeks you've been dealing with this symptom. This is the time that you need to seek out some professional assistance, like I was just alluding to. Now that these symptoms are there, we do not want to get to the point where they start to become more irritating, more debilitating, more causing you to modify your function, causing you to compensate, causing you to avoid things, causing you to skip the activities that you love to do with the people that you love to do them because something hurts. This is the time where you need to get that extra set of eyes from somebody that really knows what they're doing and knows how to help you rectify this, not tell you to go RICE it, rest, ice, compress, and elevate. This is an outdated method to try and help tissues calm down and help things heal. The RICE method does not help things heal. As a matter of fact, from an evolutionary perspective, most of the things that actually help move the needle forward and help things heal tend to be what we call active modalities, things where you're actually doing something. When we're talking about like this issue, tendon, soft tissue things, we need to loading and movement, perfusing the area with blood flow. These are the things that are going to help that area heal and get stronger and more resilient to the stressors that you put on it, so that they don't become so easily irritated the next time that you go to do that thing. Gardening, lifting weights, raking in the yard, like whatever it is that irritated that in the first place. Holding your newborn baby, something that my wife and I are doing right now. So you need to get that extra set of eyes. You don't necessarily have to do it on day one, right? Like you could, and we wouldn't fault you for that. We'd love to help people sooner rather than later, because it's easier for us, it's easier for you, it's cheaper for you, it takes less time for all of us involved when we can address things sooner rather than later. The more chronic something is, the more scar tissue starts to form in the body, the more compensations start to arise, and then the harder it is to get that thing to feel better. The harder it is to change the movement patterns that have become so ingrained when people learn to compensate around things. So I just want you to guys keep this food for thought, keep this in mind the next time you're dealing with something, or if you're dealing with something now. Take a stab at it yourself. If it's not going away relatively quickly, seek out some professional guidance, get some assistance from somebody, but make sure that person that you're getting the assistance from is the right person. And there are a few different options you can go to, but like go to somebody who's doing the things that you love to do that can help you understand how to do them properly, what's going on, and how you can fix it. And they're not going to tell you just to do things like rest, ice, compress, and elevate, like things that don't actually help solve the problem. So get out there today, go solve your guys' problems. And we really appreciate you listening to this episode on The Code. Again, if you've heard this podcast before, you've heard me say this. If you haven't, you'll hear it now. Now would be an amazing time to leave us a review. If you find benefit in these episodes, please let us know that. Share these things with somebody else. And we hope you guys all have an awesome day. And I'll catch you next time on The Code. Bye-bye.